Good morning. Buenos dias. Thank you for having me this morning. I'm going to put the time up here so I also am cognizant of the time. My parents immigrated from Mexico pursuing the American dream. They had 5 children. I'd like to say that my 2 older brothers took an alternate path in life, so I became the first in my family to graduate from high school at the age of 16, and the first then to attend college. As I was growing up, I was oblivious that I was an at-risk youth until I was in college reading a textbook. And as I read that textbook, I looked at all the at-risk factors, and I realized that I fit into all of them. Teen pregnancy was rampant in my neighborhood. In fact, a fair number of my friends were teenage moms. We had a high gang activity level, if you will, where gangs were really rampant in my community. A good friend of mine, Julia, was shot and killed at the age of 16 while playing basketball on a Sunday afternoon in the park. My friends either dropped out of high school because they were joining gangs or they were becoming teen moms. Another factor at the at-risk checklist was having low parental education. My dad went to grade school in Mexico, and my mom completed high school. We lived a life of poverty, but my parents were too proud to seek public assistance. Yet another risk in our family was violence, domestic violence, for my mother and my 2 older brothers at the hands of my father. And we had no health insurance. In fact, the first time I had health insurance was when I was in law school, when I needed a medical procedure. You could say that if we were playing bingo, I would have hit bingo right away on the checklist for at-risk factors. But I didn't know any better. I thought everybody grew up that way. I thought that everybody had a sheet of ice on the inside of their bedroom window and the living room window, and that their apartment was heated by one space heater for the entire family. I thought that the lifestyle that the Brady Bunch lived and I saw on television was pure fiction, until I visited the home of a classmate and realized that it was reality for some families to live that way, but certainly not for ours. So how is this relevant for our discussion this morning? Both Dean Finnegan and Mary Lee alluded to the social determinants of health. We know that 10% according to the social determinants of health, 10% is attributed to the environment, including urban design, the air that we breathe, and the water that we drink. 30% is attributed to health habits such as tobacco and alcohol use, diet and exercise, and unsafe sex. And 20% is attributed to healthcare. But the overwhelming majority of all those factors is 40%, which is attributed to social and economic factors such as income, education, and employment. As I reflected on my remarks for this morning, I thought about one thing, which is a quote that Gandhi used many, many years ago, along the lines of, "Poverty is the worst form of violence." And we're talking about building safe and healthy communities. That's really where I'd like to focus. If we want to build a healthy community, all of the research suggests that at the top of your list has to be inequality, all forms of inequality. Not an Olympics of the worst form or oppression of inequalities, but all of them. Minnesota is known as a land of 10,000 lakes, but for many of us, it is a land of 10,000 disparities. We're among the worst in the U.S. across education, health, unemployment, wealth, wages, access to health care, and the list goes on. By now, most of you are familiar regarding the disparities about the graduation rates and whether or not our children are ready for kindergarten. The unemployment rates for African Americans and Native Americans are anywhere from 4 to 5 times higher than for their white counterparts. So I'd like to have a deeper dive into some of the other issues that further demonstrate what poverty really looks like when we're talking about generations of poverty. By liquidating all of its financial accounts, the typical white household could replace almost 10 months of its income. That's about 300 days out of 365 days. Latino families, slightly more than 1 month, so just over 30 days. The typical black family, only 23 days of income out of 365 days of income. And a fourth of black households would have less than $5 if they liquidated all of their financial accounts. If you want to learn more about that, read the study on that's sponsored by the Pew Charitable Trust that was issued out in 2015. And a study that was published last year by the Journal of the American Medical Association provides even more evidence that life expectancy in the United States is primarily determined by economic class. Higher income is the most critical factor in longevity. The study found with the gap being between the richest 1% and the lowest and poorest 1% of individuals averaging almost 15 years for men and 10 years for women. And yet another study was issued this week along those same lines. We know why these disparities exist. It's not rocket science. So we need to shift the discussion to what can I do? What is your role in achieving safe and healthy communities for all? Disparities, we know, are symptoms of systemic barriers. And the systemic barriers require systemic change to effectuate a change and a different outcome. When we look at addressing systemic barriers associated with poverty, we must really focus on access to a quality education. It was that quality education provided in grade school for me by Catholic nuns, and again, Catholic nuns in high school. They gave me the quality education that allowed me to go further. Because you see, my friends attended the public schools in the neighborhood. And those were the schools that, at that point, the Education Secretary of the United States, Secretary Bennett, declared were the first and the most atrocious and worst public school education system he had seen in the entire country. We need to look at the quality education as an access and a trajectory for post-secondary education so that we can then stop the generational cycle of poverty and look to maximum employment for all people, especially communities of color, and healthcare access as well. So what can you do? I'm here to ask you to look outside of what you typically might think what the solutions might be and think about collaborative partnerships with unusual suspects, to form collaboration and new partnerships between health professionals, businesses, government, community nonprofits, and academia to ensure that everyone has access to high-quality education, maximum employment, healthcare, and safe neighborhoods. Despite what some people in the general public might think that you need a medical school degree, you don't. You don't need to go to medical school to improve the health of our community. You just need to care. We don't have a funding deficit. We have a values deficit. We're not prioritizing the disparities and the symptoms that lead to them as something that we all need to change on. We need to talk about health in every public policy and institutional policies because all policies have an impact on health disparities. We were asked to share with you how we define a healthy community. And I'd like to start with saying that it's access to quality childcare for children ages 0 to 4, 0 to 5, something that we provide at YWCA Minneapolis with 94% of our children being ready for kindergarten, irrespective of their income, background, or race or ethnicity. We make accommodations. We look at what the children need in terms of particular areas of growth and development, and we make that. That's what's called equity, as Mary Lee pointed to earlier. And quality K through 12 grades is imperative for our communities to achieve their systemic trajectory in a different way. When we look at achieving maximum employment for people of color in our communities, it's not about perpetuating minimum wage jobs. That does not equate to maximum employment. It's about providing the training opportunities that they need, that we all need, to be able to reach our full potential. And looking at affordable housing and access to medical care. We were also asked to define to you what we look at and what we interpret to be a safe community. Mary Lee, I think, covered quite a bit of that. I would add, for immigrant communities to be free from immigration raids, where thousands of children and adults live in fear. And the question that they ask themselves on a daily basis is my loved one coming home? Another factor I would add to that is free from abuse of excessive force by police and other law enforcement officers. Again, we have thousands living in fear, helpless that they cannot safeguard their loved ones from being killed at the hands of police. And those family members are asking, is my loved one coming home alive? When we look at what examples I'll discuss with you about collaborations, I really want you to think about how simple they sound, because really, you don't need to be a rocket scientist to do this work. There are some really practical things that we can do together in our communities to effectuate change. About 6 years ago, maybe a little bit longer, when I was working for Mayor Chris Coleman in St. Paul as Director of Human Rights and Equal Economic Opportunity, I was approached by the Director of Human Resources for the city and the fire chief. They were going to post the exam for the Firefighter Academy. And on average, it cost more than $500,000 to institute that exam. And they'd get over 1,000 applicants. But they still had difficulties recruiting women and people of color. So as Director of Human Rights and Equal Economic Opportunity, they thought I might have some input as to what we could do differently. So I looked at their process, I did some research, and I looked at the minimum qualifications required to be a firefighter. And one of the things I learned was that you needed to be an EMT. You needed to have EMT certification. And I looked at what the cost of that EMT training, and it went anywhere from $1,800 a year or a class to $2,500. That was a systemic barrier in my mind, that low-income individuals did not have access to that. So what I did then is I put together a collaborative between government, private business, and local nonprofits, actually YWCA of St. Paul, and we created what's called the Ems Academy, where we had the academy then provide instruction for EMT certification at no cost to our applicants. We paid them while they learned, so it was an earn while you learn academy. And then we also provided 9 college credits along the lines. We addressed their other systemic barriers, which were access to medical care, housing. We had some youth, unfortunately, who were homeless and living on the rooftop of our building during the academy, or food insecurity for some of our students. So we addressed all those along the way, and we had a high retention rate at that point. I'm happy to say that we have over 200 graduates to their program, many of them who have gone on to be firefighters and paramedics, working for ambulance and hospitals around the area. And that program then was duplicated in the city of Minneapolis just last year. We're entering into our second cohort. Another program that I'll share with you is our commercial driver's license program that I initiated while still in that same role with Mayor Chris Coleman. As I was sitting at my desk one day, I received a phone call from a community leader, and he told me that he was really angry because he was driving around the city in the summer, and he was looking around to see who was working on the streets. He saw city workers who were either repairing streets or cleaning streets, and none of them looked like him. He was African American. He was pretty angry, and he let me know that. I promised him that I would look into it. So I called my peer, who was the director of public works, and asked them for a breakdown of his workers. And clearly his workforce did not reflect the demographics of our city. So I did some research, and I learned that part of the job description for these street services workers, who, by the way, earned over $46,000 a year with full benefits and retirement, required only a high school education, but it also required what's called a commercial driver's license. So I looked at the cost of that commercial driver's license, and it ran anywhere from $2,500 to $5,000 for that training. Again, another systemic barrier. So I designed a program in partnership then with the local nonprofit and asked them to partner with us, with the city, and with a private institution and a college as well, where we can then provide the commercial driver's license training to these students. We were able to graduate our first class of over 50 African American men, many of whom who had either a GED or a high school education. We had one gentleman who tested at 3rd grade reading level, but because it had to do with driving and something that he had familiarized himself throughout his life, he was able to pass the exam. And our applicants, our graduates, then went on to work for the city at over $46,000 a year salary. And some went on to go to North Dakota during the big oil boom, earning over $90,000 a year. These are folks who had been systemically excluded and unemployed for 3 to 5 years at least. So those are examples of some of the systemic changes that can be made very readily that really doesn't take a whole lot other than caring about what's going on in your community and taking a different approach to what has been done in the past. At YWCA Minneapolis, we have similar programs that are underway. One of the things that we've noticed is that there is a lack of people of color in teaching, as well as child care teaching as well. So what we created then was a Child Development Associate program and certification, a CDA program, to create then a pipeline of women of color and immigrants to serve as child care associates. We target women who are at 185% of the poverty level or lower, and we give them free training. We also provide them with a stipend, and we also provide them with a practicum so that they can be in the classroom and interact with our young children at the same time. It's a career laddering position with 5 rungs to the ladder, which will ultimately get them at least in a position of earning over $35,000 a year. With our after-school programs, we help at-risk youth. Those are the same youth that I see myself in every day that I see them. These are youth who cannot afford their own after-school programming and opportunities because of their family and how they're unable to meet those needs. We provide different things during those after-school programs, such as tutoring, leadership skills, mentoring, instilling in them the need and the desire to go to post-secondary education and college attainment, and also self-esteem classes as well. Those have led to then stronger academic performance as well as higher graduation rates. Then lastly, I would be remiss if I didn't reference the work that we do with racial justice and public policy work. Our mission, after all, is eliminating racism and empowering women and girls. Within the racial justice work, we really look to empower others to be with us in terms of identifying the racial bias that exists and the implicit bias that exists in our workplace and our communities. We have plenty of trainings and workshops along those lines. We also empower people in becoming part of the advocacy and public policy change that we activate locally, at the local level, and at the state level as well. So you can support our work in those ways, certainly, by signing up for any of our workshops, and for other ways you can join our gyms, because by way of memberships to our YWCA Minneapolis, you support then the work that we do as well. Before I close, I wanted to put one more thing on the radar for you that perhaps you may not have thought about or spent enough time thinking about. I know it was the case for me until I was exposed to it about a year or so ago. Our children and families, when they're living in poverty, are exposed to toxic stress. And that has become known as trauma. And they're exposed to this trauma on a daily basis. And there's an intersectionality between the things that I've discussed this morning with you and what happens on a daily basis when you're living in trauma. There's food insecurity, there's housing insecurity, there's unemployment, there's no medical care, and people not seeking medical services because they lack medical insurance. And there's violence perhaps on a regular basis, whether it's violence within the family, like my own, or violence outside of the family, or perhaps even both. And for immigrant families, there are immigration raids. And for families living in over-policed areas, then there's excessive force of police. Those are traumas that our families are dealing with every single day. There's a professor out at Berkeley, Jeff Duncan Andrade. He talks about this area quite a bit. And the research shows that 1 in 3 urban youth display mild to severe symptoms of post-traumatic stress disorder, PTSD, on a daily basis. They're twice as likely as a soldier coming out of live combat to have PTSD. And you think about it, we provide mental health services to our veterans, which I'm all for, and my dad was a veteran both in Mexico and the United States. But we don't provide those same services to our children and to our families living in poverty. It's not just about urban youth. It's also found in the Appalachia area where you see entrenched poverty. This trauma is worse than combat PTSD because these traumas are being felt and experienced on a daily and weekly basis over and over again, which is different than combat vets because there's a start and an end to their service in the military. So think about it. Think about the amount of trauma that our children are facing when they don't know where they're going to sleep, when they have housing insecurity. They don't know when the next meal will come because they have food insecurity, and the list goes on. We can't ignore the impact this exposure has on our children's ability to develop and attain their educational trajectory that we want them to. Our low-income families have more exposure to trauma because of the poverty and because of their surroundings and systemic failures that society has imposed on them. The results show themselves perhaps in schools or in their parents' ability to keep a job or perform at a job. We have an underserved mental health system that really just does not adequately address this problem globally and then more locally within communities of color and immigrant communities. We do have some schools, however, who are starting to understand the importance of this research and becoming then more adept at delivering what's called trauma-informed services at their schools. But quite honestly, it's going to take a lot more than that. It's going to be about us recognizing the importance of the mental health services and the impact that it will have on our families, and the point that at some point we have to get to that this is part of what we integrate into their services, into our services, and not see it as an add-on. As I look at my watch, and I'm trying to get us on time here, but I don't know that Shonda's here. She is. I'll leave it with one question as Shonda comes up. What will you do to build a safe and healthy community for all? When you think about what's within your reach, what can you do differently? What can you do to challenge the current structures that are in place? And begin to think about uniting folks who perhaps don't work together, haven't worked together in the past. Think outside the box and think about how it really doesn't take a rocket science to get this. We just need to care, and we need to care about everyone in our community, not just the 1%. With that, I'll leave you. Thank you.